Hello, this video is for Unit 8 Journal, and it is a clinical rotation that I was an inpatient unit on labor and delivery floor. And this experience is with a 29-year-old female patient who was about 25 weeks pregnant and was concerned for her. She was admitted because she was having abdominal contractions, and this was her fourth pregnancy with only one live birth, and due to past losses of pregnancy resulting in premature loss of fetus, she was being monitored for her stability and retention of her pregnancy. Patient was anxious because she had a 7-year-old son at home, and also the fact that the internet at work was not allowing her to work on work because she did a online job and the firewall of the internet was not allowing her to do so. So all these kinds of different things that were going on was causing her a lot of anxiety, and we visited her as a psychiatric consult. Patient did have a history of anxiety. She was in the past on she was prescribed psychiatric medications, anti-anxiolytics, but she refused to take them. So she was on sertraline in the past, which she did not take. She took for only 2 weeks and then discontinued it. She was offered therapy. She was not compliant with it. At the current time, she denied any SI. She does have daily use. She reported daily use of marijuana. She says that's what allows her to relax, and she continues to use it. So at this point of time, when we offered her to prescribe some hydroxyzine for her anxiety, she said that you can prescribe it, but I'm not going to take it. So this was the situation where there's a patient who's non-compliant, was undergoing, reporting heightened anxiety, and the fact that she was pregnant. At this point of time, we could only negotiate with her to get some resources regarding perinatal mood disorders and mental health resources. The patient was wanting to be discharged from the hospital, so that was entirely not within our gamut of practice. We reported that to the nurse and the OB on the floor. She did have fair judgment, so at this point of time, we didn't feel like there was anything concerning with her ability to decide for herself that she needs to return to the hospital if she needs any help with psychiatric illnesses or her pregnancy. She did report that she lives close by to the hospital, and so she should be able to reach the ER within minutes if she feels like her pregnancy was not progressing as planned, or she had any concerns. During conversation, she was very much linear and logical thought, normal rate of speech, good historian. She was employed. She had her mom and dad and her sisters who lived in the neighborhood as her family support. Dad of the son was still in the picture in the sense that he was a responsible parent towards the child. The second baby was with another partner who was not in the picture. So considering all of this, it felt like a good decision to leave her with some resources, let her make the independent choice of her own health in terms of returning to the hospital if she needed. Her medical history did show that she does often visit the ER if she felt like her health she had any health concerns. So these were the pointers that allowed us to make a judgment to prescribe hydroxyzine as PRN, which she may or may not take. There's therapy referral placed, as well as resources for perinatal mood disorders and mental health resources placed in her chart. So with that, we concluded the psychiatric consult.